because I want to give back to the community that I grew up in, and I want to change people's lives.
I want to see everybody live the best life that they can, and if it takes me helping them to get there, that's what I want.
When the patients are coming in, I go into their rooms. It's comforting to know that they can actually trust me to care for them, to assist them in anything, whether it's just ambulating or oral care or just sitting up at the side of a bed. Those kind of things. I don't mind helping them out. That's me giving back.
So I knew I wanted to do like missions work. And so I was like, what kind of job supports that? And nursing, did some research. Nursing seemed like the perfect combination, especially emergency medicine, especially with that idea of missions work, because it can help me do that. But even in the now, before being on mission, you can like help people daily, especially in the ER when like they need it the most.
I'm here so that I can take care of my community and my neighbors. Like I want my family to be taken care of, and also take care of my fellow nurses the way that we all take care of each other, should take care of each other.
I just enjoy seeing the smiles on my patients' faces and making them feel heard and seen and let them know that we do care. And if it were my family member being here, I'd want them to receive the care that I would be getting if I were here. And I want them to feel safe and at home and just know that we want to take care of them. We want them to get out of here and live their life at home.
Good question. What motivates me? So I came into this nursing halfway through my life, pretty much. I got into school when I was 45, graduated when I was 50, played with great big Tonka toys most of my life, and got to a point where I was tired of that. I needed new direction. So I talked to my wife, to my mom, who are both also nurses, and they said, you should go to nursing school. And I was like, you're out of your mind. I'm too old to go back to school. And I quickly realized I wish I'd done this my whole life. It's been very satisfying to help other people. The more you get in and get to know the people, the better the stories are, and the better connections you have with your patients. And it's been very rewarding and a great way to help other people.
It is hard to put into words a 20-year career at a community hospital. Where I started was at the bedside, and everything was new and exciting, and you're learning all of these skills and how to provide great care. You're having new experiences almost every shift. That is new, that is exciting, that is different. And then you get to a point where you realize that there's an opportunity there as well, that it's more than just providing the skills and the tasks that that patient might need at that particular time. You're taking care of a person with their own unique story. And there's almost a space there where my story can intersect with that patient's story. And I have the opportunity to influence, I have the opportunity to support, I have the opportunity to do more than just nurse. I have the opportunity to impact a person. And that has been my purpose. But my purpose has also evolved and changed as I've moved through my years here at this organization. As a nurse manager for the ER, my purpose came to be empowering those that I had stewardship over so that they had everything that they needed to provide that care for that patient, and so that they felt like they were cared for as well, that they were supported, that they had what they needed. And I have seen over my years many amazing experiences, amazing stories with patients, but also with our staff. Their growth and their ability to change and adapt and to reach their purpose, to reach their potential. That's exciting to me. Now I have the opportunity to to work at a different level. As a chief nursing officer, I'm not just over a department, I am responsible for all of nursing. But that same key purpose still drives everything that I do. And that is to make sure that our nurses have everything that they need. Do they have what they need so that they can provide those unique experiences for patients? Not only that, but can they provide those experiences for each other? Can they assist in each other's growth and help each other reach their full potential? Can they discover their purpose as they work together? I love that idea of having purpose and doing things on purpose, and that we do that better when we do it together.
When I started on telemetry at St. Mary's, I loved it, but I knew it wasn't my fit. It wasn't my niche. I knew it wasn't, but I wasn't sure what was. And so I started spending a lot of time with discharge planning. And then they had an opening and they all came to me and said, you have to apply for this. I applied the first day as a case manager. It was a slam dunk fit. I was like, this is what I'm supposed to be doing. Shayna was in school. She was 7 or 8. And I was able to work Monday through Friday, 8 hours, so I could get her to school. I could get home right after school, so we didn't have to do daycare anymore. And it just all completely fell into place. And I love it because I love a good mystery. I love solving a puzzle. And I can't imagine not ever doing this, because it's what I'm meant to do.
To not give up, to show my children that they have a strong mom ahead of them. And also, I like to be a detective and find out all the mysteries while I give back to my community.
When I say I've been given a heart for nursing, there's something inside of me that just wants to take care of people and to show love and compassion to people. And like I was saying before, like I want to see people physically and mentally well and to be able to live well. And I feel like I learn all the time about how to educate them and how to teach them how to do that. And it's just a passion inside me that I didn't know about before.
I became a nurse on purpose. I knew from a very young age that was always something I wanted to do. I wanted to make a difference in someone's life, in multiple people's lives. I wanted to fulfill that need in me, that I was called to do something. I wanted to challenge myself, not only myself mentally, physically, emotionally, but to be there for someone mentally, emotionally, and physically. And the hospital it gives that opportunity to serve the people that way, to serve someone and make a difference in their life. And I wanted to be able to make that difference in someone's life and then be able to be like, someone heard me, someone understood, I have something I can do outside of the hospital now. Like I have answers, this isn't the end of the world. Just giving them the understanding of how we deal with challenges of our body and mentally and emotionally and how that all combines together. And so I was able to do that when I became a nurse.
When I first got my CNA, I was just happy to have my CNA and to work in the field. And when I started here, I didn't have no intentions on continuing my education. I wasn't even thinking of nursing. My mom once in a while would say, you know, you should think about nursing, but I didn't even think like that. Working here, seeing everyone pursue their bachelor's, master's, or they're either taking a class to get certified, it was really motivating. And that was so motivating where right now I'm taking A&P2 and all I have left is micro, and I'm hoping next year I can apply and I can follow that same journey with everyone else and continue working here, as I like giving back to the community.
I see nursing as more of a calling. We all have vulnerable times in our lives where we can't help ourselves, and myself included. And it was nurses that were there and that took care of me. And I never had planned to go into healthcare. I actually have not been a nurse that long. And it was a calling that found me, and I love being a servant leader. And being a servant leader is, we are there to serve others before ourselves. We're there to help each other grow. Investing time in somebody else's health and wellness and it is very much a calling.
I became a nurse because it's very interesting. The human body is very amazing, and it's very fun to get to figure out and take care of people. And rewarding too, it's very rewarding.
I think I just like caring for people, like helping them, and like it's kind of their worst time in their life. And even if they're grouchy, I know like that's just because of their condition, like they're not feeling well, and then I just want to be there to help them and support them through that time.
I'm Dr. Phil Johnson. I'm one of the lucky ER doctors that get to work here at White Mountain Regional Medical Center. I've done this for many years. A little of my background, I have been a Fulbright Scholar. I've taught internationally. I've also been an assistant professor teaching ER residents and medical students. And I was also medical director at Summit Regional Medical Center of the ER for over 15 years. So with that backdrop, I'd like to make a comment regarding Nurses Week. First of all, medicine in this country and everywhere, it's a team sport. And really, to do medicine well, you need a complete team. And so I don't want to leave out the importance of techs and housekeeping and everything else, because we're a team sport and we're a great team here. But because it's Nurses Week, I just want to focus on the nurses. The nurses are the most important part of the team because they're there on the cutting edge of what we do. They're there providing the care to the nurses, getting the IVs done, getting all the technical things that they have to do. And I love the nurses I work with. And I think I'm working with some of the best nurses really in the country. And I'm comparing the nurses here with the nurses I've worked at in probably 10 states, in probably 15 ERs over my career. And I would pit these nurses here at about the top 10% of all nurses I've worked with. They're incredible, they're caring, they're giving, and their skill set is amazing.